This is my client Mark, and he has had a surgical procedure to lengthen his left leg. And he presents with knee pain. He gets some foot pain on both sides when he stands too much. And he has low back pain primarily on the left and SI area, and gets left hip pain, has a history of prior right hip pain which improved much when the leg length procedure was done. He does present today with his left leg being longer by what appears to be a ½ inch. And the left patella has reduced mobility in comparison to the right patella. I can load and spring his right femur. I can't really load this. When I try and spring it, there's no movement there. It appears that the femur is stuck in posterior glide in relationship to the tibia, which would induce some hyperextension in that knee, and he in fact does have hyperextension. He also has a positive drawer test or Lockman's test, and I don't know if the camera can see that, but that is increased movement of tibia on femur. And he has the same here, just not as much. I don't know if you can see that little bit of give there. Perhaps from playing ultimate frisbee. Any other sports you played, soccer or anything like that?
I wrestled a lot when I was younger in high school, but that's been over 10 years at this point.
Okay, that could be. So one thing we want to do is restore that anterior glide of that femur, and that might reduce his hyperextension. It usually does. And then looking at the pelvis, he has considerable asymmetry. I don't know if the camera will capture that or not. Yeah, side angle, yep, very good. So this ASIS is much lower than the ASIS on the left. And I can load the left side and I can spring the left side. I'm not able to load the right side, and I'm trying to spring it, and it would take a much greater amount of force. Do you feel that difference?
It's very painful on the right. On the left, it's not as much.
Okay, so it's painful when I push on the right. And do you feel a lack of motion?
Absolutely.
Okay, alrighty. And when I palpate his lower pubic bone, the upper and the middle face are equal, but the lower part is posterior. And so there's a posterior rotation of the left pube. And there's probably a subtle asymmetry near the top, but that's where the axis of motion is. And so it's too subtle for me to perceive that visually. But if you would lie on your stomach.
Sure.
And what that pubic rotation does is it moves the left ischium posteriorly. So this ischium is closer to the ceiling, and motion is also blocked when I try and spring it anteriorly, whereas on the right I can take up the slack and I can spring it very freely. Okay? Now because the ilium is rotated forward, he lacks inferior glide motion on the right, but he has good inferior motion on the left. He has good superior glide on each side. The sit bones are shifted to the left subtly, and I don't think the camera angle is going to capture it, but his left sit bone is closer to his midline crease, or the left one is lateral, or both actually. I can't spring the left sit bone ischium medially. There's no give there. And when that happens, there's also a lack of spring mobility on the right side, either going in or going out, and a lack of movement going out. So that means that that's stuck at end range. Along with this pattern, we often see a left side bent tailbone, and he certainly has increased tension of the sacrotuberous ligaments. This feels like bone, but it's a ligament. And this sacrotuberous ligament I can indent a little bit. And you told me earlier you feel that difference.
Absolutely.
Okay.
It feels like a bone when I sit on it.
Yeah, and then sacrospinous ligament is right here, and that feels like bone. And sacrospinous here I can indent. Okay, so if you want to come over here with the camera and see if you can look straight down. So here's the tip of his tailbone, and you can probably see that my right finger, his left, is higher up towards his ear. Can you see that? Okay, so that's because the tailbone has wings, transverse process, and it's side bent this way, so this wing has more space. He also has a rotational fixation in his mid-thoracic spine, and then his occiput is stuck in right side bending, but I'm not going to show those two patterns. I'm just going to focus on lower body. And so we have a little bit of work to do, and the question is, will he ultimately need a lift for his leg length difference, or can we get his leg lengths equaled out by addressing pelvic asymmetry? So that remains to be discerned. And in addition to these patterns, he also has symptoms of pudendal neuralgia, pelvic floor dysfunction. And that is fairly common with the lower windswept pelvis. So I hope that we can impact those symptoms as well. Thank you.